Welcome, parents and professionals, to tonight's webinar about attention deficit hyperactivity disorder in children and teenagers. Thanks for joining us. I'm Chris Tran, psychologist, and I'll be your host for tonight's session. We're coming to you from the lands of the Wurundjeri people and Bidjigal people. I'd like to acknowledge the traditional owners of all the different lands that we're on and pay my respects to the elders past and present and to any Aboriginal and Torres Strait Islander people with us tonight. This webinar is live and interactive, so we'll be interacting with you through polls and activities. You can also ask us questions and share your ideas at any point using the discussion forum, which is on the right-hand side of your screen. The webinar is best viewed using a computer or laptop, but you can also use other devices. If the video stops, try to refresh the webpage. We're joined by Ben, who will be your moderator in the discussion forum. If you have technical problems, please click the red live support button at the top. Also, we want to let you know that this webinar is being recorded and a link to the recording will be sent out next week to everyone who's registered. So keep an eye on your inbox. This webinar has been developed by the Parenting Research Centre and is brought to you by the Raising Children Network. We'd also like to acknowledge the support of the Victorian Government in funding this webinar, which is why we're able to bring it to you at no charge. If anything discussed here today upsets or concerns you, here are some places that you can go for further help. raisingchildren.net.au has numbers for Australian helplines and hotlines. There's also the number for Parent Line in your state at the website too. There's also Lifeline, which is a 24-hour crisis support line. The number's 13 11 14. This webinar is suitable for parents, carers, and professionals who want to learn about attention deficit hyperactivity disorder, or ADHD, in children and teenagers. It contains general advice. We do encourage questions, though we'll focus on questions that could apply to more people in the audience rather than very specific cases. If you do have specific questions about your children, please contact your local health professional. Okay, so now we're going to run a poll, which I see that some people have already found. We'd love to know a bit more about who's in the audience. If you haven't seen it yet, it's on the right-hand side of the screen as well. If there are any issues with the poll, feel free to just put your answer in the discussion forum, which is also on the right-hand side of your screen. The question is, if you are here with a particular child in mind, how old is this child? And you can choose from 1 to 5 years, 6 to 12 years, 13 to 18 years, older than 18 years, or I'm here as a professional. And we'll just give everyone a minute to get some responses in. But thank you so much for putting in your responses so far. Got a few more coming in. Alrighty, so it looks like we have the 6 to 12 years in the lead at 38%. There's a tie between people with a child that's 1 to 5 years in mind and people who are here as a professional, followed by kids who are 13 to 18 years. And then we have 0% for people thinking about someone who's older than 18 years. Now, thanks for filling that in, everyone. I'm just going to end the survey. If you haven't had a chance to put a response, feel free to put that in the discussion forum. Alrighty, so if you need to leave early tonight, that's completely fine. We would really appreciate your feedback via the survey in the handout section, which is also on the right-hand side of the screen. And tonight, our speaker is Dr. Daniel Payton, pediatrician, researcher, digital health product designer, and father of 3 young children. Dr. Daniel Payton is a general pediatrician at Inform ADHD Clinic, Geelong Children's Clinic, Wathaurong Aboriginal Cooperative, and Barwon Health. He's passionate about helping children reach their potential. For his PhD, Daniel has co-designed and developed a new website for parents to help them find ways to help their child's mental health problem, including strategies, online programs, and listing local specialist services. He's trialing this website with families in Geelong. Welcome, Daniel.
Hello, everyone. As introduced by Chris, my name's Daniel. Thanks so much for joining me. I can talk about ADHD for a long time, so I'll try and contain myself to allow plenty of time for questions at the end. But the main points that we're going to be covering today is around what ADHD is, some common characteristics of ADHD, when and where to get help, which is a really tricky question. So I'll be touching on a few important and hopefully helpful points for you then. How a diagnosis can help, and we'll be touching on what supports are available for children with ADHD. Okay, so to start off with, I think it's important to reflect on what we all think ADHD is, and this is one of my favorite starting points in clinic, is to sort of get people's understanding, of what they know or experience or, have seen regarding ADHD. So it's important to recognize that ADHD is a natural variation that exists in how people's brains work, and it's been described for a very long period of time. Its rates are actually, fairly stable. We'll talk more about that over time. And it's, these differences can be seen in children with ADHD on functional MRI scanning, on MRI scans, looking at the anatomy. And we think that, this is all to do with different levels of, neurochemicals that exist in the brain. And with these differences that exist, there are a number of strengths that children with ADHD can have. Things like innovative thinking, and all you have to do is look at a lot of the most successful tech people in the world who have created, very innovative things, mostly hopefully for good, and a lot, there's high rates of ADHD, in those populations. It's also associated with a lot of adventurousness. Children with ADHD may, be keen to go off from one thing to another, try something new, go and explore. And it can also be associated with hyperfocus or productivity. If there's something that they're really passionate about or love doing, they can spend a long period of time, focused on that particular task, working their way through it and being really productive at the same time. And it's also associated with a lot of curiosity, about new or interesting things, easy to follow one's passion in those situations. But then we think about some of the other characteristics, particularly around the diagnostic, characteristics of ADHD. And we sort of have these, these three areas of sort of inattention, hyperactivity, and impulse control difficulties. And I'll go through that in a little bit more detail. And when we're talking about inattention, we're talking about difficulty getting organized, maybe being easily distracted, losing focus, being forgetful. And, these are symptoms which we all experience. I've probably experienced it today. I forgot how to unmute Zoom just before. Doesn't necessarily mean that I have ADHD, or we have ADHD when we exhibit, these symptoms. The thing that's, I think, really important to grasp with ADHD is that part of the diagnostic process is children with ADHD have much more of these symptoms that are displayed more often in more situations than others. All right, so I got distracted there a little bit, but we've got our inattention, then we've got our sort of hyperactivity and impulse control. And hyperactivity and impulse control are closely related. The hyperactivity we might recognize as things like fidgeting, constantly on the go, driven as if, by battery, talking lots, or, with the impulse control issues, acting without thinking, interrupting others. And it's important to recognize that these are the sort of diagnostic, criteria that we have in terms of the symptoms of ADHD. But there's also a whole bunch of other stuff that's associated with ADHD. Things like emotional regulation or executive function, challenges, the hyperfocus, which we mentioned, or difficulty with attention switching. There's a whole bunch of stuff that is associated with ADHD. So let's start recognizing some of those characteristics in the real world. So what ADHD might look like at home. A couple of things that we might recognize. One of the most classic ones that families describe to me in clinic is some challenges with the morning routine. This is a very common one that I hear about. When we're in the morning, there's a certain number of things that we've got to do before getting out the door. Wake up, get dressed, have brekkie, brush your teeth, brush your hair, pack your bag, shoes on, out the door. But children with ADHD can find this particularly challenging for a few different reasons. Might be getting there a couple of ways down the list, and then something else comes up that they're really interested by. Maybe there's a new Lego set, or someone's playing something outside, and they just can be off, and then they're very engaged and almost got a hyper focus. Perhaps in some other difficulty, and it's difficult sometimes to bring them back to those set tasks that are required of them in the morning. Also, it's when kids are doing this, families can get really frustrated by this. And I think one thing that I just wanted to raise as well is we all have this parenting voice that I think we use. Justin Coulson's talked about this before. It's when kids aren't following their list of requirements of what to do, sometimes we know what we mean by parenting voice. We bring out this parenting voice. I do it. I don't like my parenting voice. But for children who are doing these things and have a natural tendency to maybe get distracted by other stuff or forget what it is that they're next meant to be doing, sometimes as parents we can spend a lot of our time in this parenting voice mode with the kids, and sometimes that can not be helpful for them longer term. It's better if we can try and prompt them or redirect them more gently without escalating our voice or using other forms of potentially just increasing the octave to try and get them oh yep, sorry dad. Hopefully there's other ways that we can gently bring them back to what it is that they're meant to be on next. Another classic characteristic that we hear about or see more often in children with the hyperactivity tendencies is this inability to stay seated at the dinner table. You've got the 8-year-old who might have ADHD or ADHD tendencies, and they're at the table and they're up to get a glass of water, back, kind of get some sauce back, toilet back, get something else, a Lego minifig back, get that book, and it's up, down, up, down. And then you've got this, the younger sibling, who's developmentally, not quite as advanced as the older sibling, but they're just sitting there watching. They might not have ADHD, and they're just sitting there watching this older sibling up, down, up, down, up, down, as a recognition of, that might be a bit different, developmentally, for what's appropriate developmentally at that age, or those characteristics are occurring more often. Another one might be when you're sitting down doing the reader, and the kid's sort of doing the reader but upside down, because they've just got to move and constantly just get just while they're trying to focus and get their work done. Okay, and then we can see some of the characteristics that might be present in the classroom. And I'm not a teacher, so I don't have a lot of lived experience talking about this topic. And respect to all the teachers out there tonight who do a wonderful job in helping recognise and manage these characteristics in the classroom. And if you've got some stuff that you want to put in the chat, that might be useful. Things that you've seen and noticed. But the classic ones around this sort of distraction. If we focus, we've got our task, get done. Okay, let's work on our task, and then there's there's something going on out in the corner of the classroom, a noise, or someone saying something. So, what's going on over there? And all of a sudden, their curiosity has led them away from what's required to be done in that setting, and they're potentially off to do something else, or an inability to sit still. So I've got one kid who just articulated it beautifully, where he's trying hard to sit in the class, wants to get the work done, but then finds himself sometimes just up and out of his chair, having wandered around, and he's like, what am I doing? How did I get here? And sometimes he gets a bit frustrated at himself when he does that. And it's important to recognize that if kids have got those, those natural variations, we want them to have their self-compassion for that as well. because, if you're up and out, other kids might be critical, or maybe teachers asking them, it's the fourth time, they're getting frustrated, using maybe their teacher voice. I don't even know if that exists. Tell me or not in the chat, and trying to get them back, to come down. And sometimes, for this kid that I look after, he gets a bit bummed out about that, because he wishes he didn't do it, but regularly finds himself often doing it. Another one might be disorganization. So as everyone's get their stuff out and we're missing a bunch of stuff. Or one that, I hear a lot about, particularly in older kids, is this, failure to hand in more complex work. It's one thing we're doing a math sheet, questions 1, 2, 3, all the way down to 20, work our way through the list. Much easier to stay focused, in that numbered list of what we've got to do, than perhaps in 4 weeks, we've got this big piece of work done. This is the outcome of what I want you to do. Now you've got to work out how you're going to get there. That's a lot harder to be organized for, to plan, to sort of comprehend those steps and get each of those steps done. And so what you can see sometimes in children with ADHD is the avoidance of that type of work, which needs more mental effort, or procrastination until there's a time pressure. And in the playground, and this is one that I think I spend a lot of time trying to explore with families, is what are the ADHD characteristics and how might they be impacting, the child in the playground. And here are some, potential examples. While, some kids with ADHD are heaps of fun, often doing fun things, got this group sort of following them as they're off on the next exciting adventure, or, constantly got some fun game that they're wanting to create or play. Sometimes it can cause difficulties, such as paying attention to what others are saying. If I'm, telling Gemma a story, and Gemma's got some difficulties with, attention, and I'm telling a pretty boring story about Star Wars, no offense to all the Star Wars fans out there, and Gemma's trying to, listen to this, and if it's not that interesting, she might just get distracted by other things. And then I'm like, oh, Gemma doesn't like my story. Maybe she doesn't like me. And that can sometimes affect, the relationships for kids, especially as they get older and they get more aware of that sort of stuff. It can also present as potentially difficulty taking turns. If we're playing a game or having a conversation, I say something, then say something back. And if we're both, if someone's really excited about it and they're just, they've got some difficulties with that impulse control, they just start interrupting, and, they don't listen to what I've got to say and take turns. And I listen, they're just constantly, excited and just want to just put more of their, they don't want to hear what I want to say. I couldn't say what I wanted to say. Sometimes that can hurt, my feelings, and then that can hurt the relationship. And all these, they're fairly small things, but accumulated, often in many settings, for a long period of time, that can sometimes create some difficulties. And the other one is around emotional regulation and acting out. And this is around that impulsive behavior. And I'll probably spend a little bit too long talking about this, but I think it's a really important one. We all get annoyed or frustrated or angry at times. It's a normal emotion. It's unpleasant, but a normal one. When I'm talking to the kids in clinic, I give an example of, how we can sometimes feel this emotion and then want to act out in a certain way that can sometimes be undesirable. And children with, impulsive type ADHD can do this more often. And an example of that is, if someone does something, you're frustrated, annoyed, then you act out, and that can, affect that relationship. That impulse control isn't there. And I'll give you an example of what that impulse control is, and you can see maybe if it's happening on a regular basis socially. But if I'm driving home from the hospital in Melbourne and going down the Western Ring Road Friday afternoon, 4:30, traffic everywhere, I want to get home. Maybe I'm going to see the kids, or got to make a deadline or something. We had a bit of a lousy day. Someone cuts me off on the freeway. Most of us feel, frustration, anger, annoyed. Some don't. Some feel rage. We all have these emotions when someone does that. And then what do I feel like I want to do? Is maybe wind down the window, maybe stick my hand out. Kids will find this pretty funny. And then maybe make a rude gesture. And then, but I don't. Most of the time I don't. I don't want to put my head out and say anything, because even though I've got that emotion, I can regulate that impulse of that behavior. Children with ADHD, impulsive type, find that much more difficult. to do that. And then that can get them into difficulties because they can say things or act out in ways which can impact those relationships. And again, we all have these moments, but if we're doing it more often and have more of these moments, then that can accumulate over time and can cause a significant impact. And then that's the other part about ADHD that I like to talk about is, when we're diagnosing it, really when I diagnose it, I think about it in sort of two terms simplistically. Collection of symptoms or traits, characteristics, which everyone has, as we've talked about, inattention, hyperactivity, impulse control. Everyone has that. But children with ADHD have more of those symptoms or traits more often in more situations. So have a drink of water, sorry. However, that's not the hardest part. The hardest part of my job is often finding of whether that impact is significant. And significant in one of these three areas. Academically, we look at the slides, the classroom, socially, in the playground, or emotionally. Perhaps, at home, as we use our parenting voice, maybe, it can accumulate over time, especially these kids can face a lot of, punitive measures or discipline or harsh, responses. And that can, if we're seeing that they've got a lot of these traits or characteristics and it's causing a significant impact in one of those areas, that can be ADHD. So the rest of my family's sick at home. I feel like hopefully I'm not catching anything right at this moment. Okay, so now spend a bit of time talking about that, but I think they're really important concepts. The next part I want to talk about is how common ADHD is. Around 6 to 10% of all Australian children have ADHD, and that's been fairly constant over time. Hasn't really changed much over the past 30 years, unlike many other forms of mental health problems in children, which are going up and up and up and up, sadly. It's more common in boys than girls. It's more common in primary school kids than secondary school age kids, which is interesting because we think of ADHD as being fairly static, but it's not. Kids tend to grow out of it over time. They'll always have those tendencies or traits, but just because you reach diagnostic criteria in primary school doesn't mean you're going to reach it in secondary school or in adulthood. Always have those traits, but may not reach that diagnostic threshold. So some children, as I said, can grow out of it. More common to grow out of it in girls than boys in terms of the diagnostic criteria, but may always have those traits. And the demands, conversely to that, the demands over time can increase. So even though things might be pretty mild early on in primary school, set structures, good environments, understanding peers, sometimes in secondary school with more demands, it can get a bit trickier. Excuse me. So let's talk about some specific examples. So the first one we're going to talk about is a preschooler, and I'll be touching on some points around the early intervention. So Gina's 4, she goes to kinder, she's very popular socially, makes lots of friends easily, moves easily around the different social groups, can create, good reaction, a good attachment with people, fairly quickly. She's very busy though, moving from activity to activity. At group time, on the floor at kinder, she can be a bit of up, down, struggling to stay on a spot. Whereas the others might find it a lot easier. As I said, she can make friends quickly, but struggling to really make those deeper connections because she's moving on quickly, to something else, but very happy, lots of friends. And she can get frustrated by people when people maybe aren't following the rules or doing something that she doesn't like. Sometimes she can act out, but she's 4, everyone tolerates it, all happy days. We don't really diagnose ADHD before school age, very rarely. Only about 2% of ADHD diagnoses are before schools, are very uncommon. Because a number of these traits or symptoms, they can improve over time, and when they enter school, different expectations and stuff, sometimes there's no impact. But then we can talk about this early intervention concept, which there's no hard and fast definition of this, but when I think about early intervention, for these preschoolers, I really want to help them in the areas that are sort of most important to me as a clinician in the longer term, which is social and emotional, that well-being, sense of self. So how can we help socially? And there's a great RCN, webinar on this. Or how can we help with the emotional regulation, with their, helping them when they're having that big feeling, what behavior is going to come from that? Because the more we have awareness of how we're feeling and able to communicate that to others, the more we're able to, regulate that response. And the first of many plugs for the program Tuning Into Kids tonight. This is a fantastic program, group program for parents, runs over 6 weeks, often run for free by your local council. And everyone in my family has done this program. It's, I would think, the best way for parents to learn to be emotion coaches, and it's very effective with the teachers noticing an improvement in the child's behavior and emotional regulation when they're, as a result of the parents doing the course. So if you wanted to upskill yourself in emotion coaching and help the emotional regulation of your child, I think that's the best way to spend some time as a parent. We'll put some links up at the end as well. All right. Next, we're going to talk about is Kai. So he's 8. He's very good fun, very busy, constantly on the move to try new things and do things, giving things a go, not afraid to do stuff in front of people, which is a good skill, which I really love to see. And he often, in school, though, in class, he can get up from his chair and move around a fair bit. And recently, there's been a few incidents with other kids in the class, where someone's done something that hasn't quite, gelled well. Kai didn't like it. Maybe there was a sense of injustice around it that made him feel that, a wrong was done. And he's acted out at times in ways that, he later regretted. And it's interesting with this impulsive behavior, often there's a lot of remorse and regret, which we may or may not see. And it's really important to encourage kids with that repair work. And he's talking a lot in class. It's never really caused problems, for him, but now in that sort of grade 3 to grade 4, it, might be starting to be a little bit more of a gap in terms of what the developmental sort of norms are, expectations. There's more of an impact, from those traits, which he's always had, but potentially more of an impact now. And particularly on, on how he feels or how much work, he can get done, whether he is meeting his academic potential. And then finally, we have Mackenzie. She's 14. She's in Year 9, always done well at standard, sort of academically. But recently, as the demands have sort of, gone up, she's found it harder to get that work in, and that work in on time, to a standard that we're sort of used to seeing, particularly with the more complex and sort of open-ended work. Forgetting what she's meant to do at night, bringing home the wrong books. Before it was just the one book. Now there's like all these different subjects, and avoiding, doing a lot of that homework or anything that needs that extra mental effort, except for maths. She's got a great maths teacher, got a really good relationship with them, and she's always been good at it. She's got that competence, because that makes us feel good about stuff. Is when we're competent at things in front of others, it's a really healthy thing to feel. Because we've all got our own strengths and superpowers, and it's good to be aware of that and thrive in those environments. And it's potentially, the structure, also step 1, step 2, step 3, step 4, makes it easier for her to sort of work through. Less chance of her getting distracted or disorganized, or if she does, she can just come back to that worksheet and work her way through. It's fairly well geared to, and so she may have inattention with an academic impact, depending on how much it's impacting her. Okay, so we'll talk a little bit now about the causes of ADHD. Number 1, right at the top of the list, the biggest risk factor is genetic. When we think about ADHD, 75% genetic, which kind of doesn't make sense when you put a number on it, but that is the biggest factor that influences, whether a child is going to develop ADHD. There are some other associated risk factors, things like being born a bit early or at a low birth weight, alcohol or drug use during pregnancy, and there's associated with other neurodevelopmental or mental health diagnoses, things like autism. ADHD, very common with autism. I think the latest data that I've heard is like 8 out of 10 children with autism have ADHD, but only around 1 in 10 children with ADHD have autism. So 1 in 10 who have ADHD have autism. But there are also a number 1 in 10 who have ASD traits but don't meet that diagnostic criteria for ASD. Epilepsy and other exposure to environmental toxins. And then I think it's also a good segue into, ADHD can, a lot of other things, can look like ADHD. We've got things like anxiety can cause difficulty concentrating because there's this rumination or other thoughts, what are people thinking about me, that are consuming their sort of, their attention space. They can't focus on what it is that they need to do. Autism can look like ADHD, particularly if there's that hyperactive or inattentive social aspect, causing social impairment. Specific learning disorders such as dyslexia or trauma can all look like ADHD but not be ADHD. Confusingly, they can all also co-occur with ADHD. I hope I haven't lost you. It's a bit confusing, but there's a lot of this stuff overlaps, and they often commonly live together as well or exist together. So we know that these things can occur with ADHD, challenging behavior, anxiety, mood problems, learning and language disorders, intellectual disability, sleep difficulties, tics, developmental coordination disorder, and emotion regulation difficulties. A big one, 40 to 50% of kids with ADHD experience difficulties with their emotional regulation. And again, second time tonight, I'm going to put in a plug for the Tuning Into Kids program. It's probably going to say it a few more times. Apologies for that in advance, but a really effective way of helping kids learn skills in emotional regulation. Alrighty, when to get help? Tricky one, no hard and fast rule, but a couple of little guides that I like to think about is one, if there's a number of risk factors and there's characteristics of ADHD, it's probably a good time to get checked out, to check for those, level of symptoms and whether or not there's an impact present or not, a significant impact present in those areas of either academic, social and well-being, how we think or feel about ourselves. Another time, if there's not those risk factors, is if there's a number of ADHD characteristics and they're there in two settings. Think of home, school, or the one I keep talking about is socially, and it's causing disruptions, then it's time to get help. And GP is a good place to start. But there are a number of places that you can go, and teachers are another really useful resource in terms of helping make adjustments or accommodations at school. Because when we're talking about ADHD, we're not just talking about a diagnosis. We all want to understand kids individually, individual strengths and weaknesses. And some kids may have difficulties with attention and hyperactivity, and we want to help them with that, whether or not they've got a diagnosis, if that makes sense. But I think that's a really important point. So there's a lot that you can do, in terms of strategies in order to help with problems related to inattention or hyperactivity or impulse control. All right, so getting an assessment or diagnosis usually involves a combination of clinical and psychological assessment from someone like a pediatrician, a child psychiatrist, or some psychologist. And I recognize there's a lot of challenges, in our community in accessing these diagnoses that I wish weren't so. But that's the diagnostic process that we have. And then when we're going through the assessment process, what it usually involves is it's done over a few appointments, interviews with you and your child, questionnaires, a really important part of it, trying to understand what the symptoms are like or the characteristics are like in other settings from other people, not just sort of self-reported or what's happening at home. And sometimes there's other tests that need to be done, other specialist learning or educational tests, language, speech, general health checks, and whatnot. And then this is the criteria, distilled down into its simplest form. This is when we're diagnosing ADHD, we look at this criteria, the DSM-5, to understand whether or not they meet, the diagnostic criteria, but still knowing, as I said before, all kids have different strengths and weaknesses. And if they're experiencing challenges related to, inattention, hyperactivity, or impulse control, we can still help them, even without a diagnosis. The diagnosis helps with a few specific things, which I'll talk about in a moment. I'll talk about right now. A diagnosis can help with understanding. So when we have, a diagnosis, we don't have to have a diagnosis to help with this, but we know that it can. understanding what it is that we're seeing and recognizing it for that, the neurobiological, the neurochemical changes that exist, to explain why kids have, a certain number of characteristics that cause a certain picture in some environments. A diagnosis can also help with, self-compassion. And as a family said to me just recently, the validation. This is what parents can feel. And something that I work a lot with kids is when they're experiencing their symptoms or traits, is having self-compassion for that. You don't need a diagnosis for that. We want kids to, all of us, we all have our own strengths and weaknesses. I won't get my wife to talk about all of my weaknesses because we'll be here for a long time, but we all have our own strengths and weaknesses. And it's important that we recognize that and accept that. And we don't want to torture ourselves or try and change necessarily who we are, based on that. That's self-compassion, recognizing our symptoms, our traits, and learning to, accept those. We always want to try and do better and improve, but there are some things that we have natural tendencies towards, and that's okay. A diagnosis can help with working out which therapies or supports are more likely to be helpful, because we have wonderful things like really good evidence bases for things like, fish oil and excluding some food additives, to help with ADHD symptoms in children. There's some good literature on that on the Raising Children Network website. And there's also, it can help us in terms of understanding what therapies or supports are most likely to be useful. Things like, medicine with ADHD, and medicine for ADHD is very effective and one of the most effective medications in all of mental health. And it also helps us look for other related issues, associated with that ADHD, which we've touched on. Then what are we going to do about it? Skill development. It's a tricky one, because we want to love our kids for who they are and accept them for what it is. And we also want to help them reach their potential and get better at stuff. So it's a tricky position to be in, because sometimes I feel like they're at conflict. But one of the things is we want to give them some extra skills, gentle and supportive ways to help them overcome some of their difficulties. For example, if we're forgetful, we can write lists. We can draw, checklists, in the morning routine. We've got plenty of signs around, happy signs, of these are the things that we've got to get done, and we can tick them off or just prompt us or remind us just to stay on track in a non-punitive or non-harsh way. That's an easy way to help make those strategies or adjustments in everyday life to help kids overcome, an environmental change to help them overcome the difficulties associated with their natural tendencies. Adjustments to the environment. I really like thinking about this one because, when we think about the, mental health space, and which ADHD fits within the mental health space, we want to make these environmental modifications to suit, their neurodevelopmental profile. And sometimes it's a bit weird. We want to try and but sometimes we just want to change the environment to suit them. I constantly talk about, if I was in charge of schools, there's 4 schools around where I'm doing this presentation right now. And if I was in charge of schools, it wouldn't be like 4 of the same primary schools. There'd be a Pokemon school, Taylor Swift school, Outdoor Ed school, Geelong Cat school. This topic of interest to help them stay engaged, and help them with their symptoms or with their traits and how they're expressed at school. Obviously completely ridiculous, and that's why I'm never in charge, but it is a nice thought exercise. And mental health supports, as I talked about, and we'll probably talk about it a little bit more in a moment, and medications, which I've raised. Okay, and when we're talking about what those good supports and strategies look like, we want to make the most of their existing skills and superpowers. Like the schools, if we've got a topic of interest that we're passionate about, we want to build on that. We want to keep that interest engaged in that topic and deliver, the lessons that are learned. If you're going to do a morning routine thing and it's a Geelong Cats, it's the picture of the Geelong Cats footy players doing each step. I don't know if that exists or not, but geez, it'd be nice. I'm sure AI could make it, of like, getting dressed, brushing teeth, brushing hair, having brekkie, getting shoes on, out the door, just to help, keep them engaged. So we're helping them navigate those challenges that are related to their natural tendencies and build on their strengths. Okay. And the support for ADHD, as I said, we can start with the GP. Often a pediatrician or psychiatrist can be useful from a medication point of view. And teachers are great for helping with what strategies can be implemented and understanding a child and how they're functioning in the classroom. And in many cases, you can also get help from psychologists, particularly for teenagers. Psychology should be offered to all children. Not that they should do it, but it should be offered for all children with ADHD, and group programs for parents. And bonus for all of everyone knows what I'm about to say next, that Tutoring into Kids program, very effective way of helping emotion regulation and being an emotion coach for your child. Alrighty, and here's the resources that I wanted to sort of share as well, and a particular plug as well for the Tuning into Kids course, and also the Royal Children's Hospital strategies list for ADHD. Is a long list of strategies. You just got to work out. There's a hard and fast rule. You just got to work out what's going to fit well with your child or your situation, and trial some and see if they're useful or not. And the ADPA, the Australasian ADHD Professional Association, has some wonderful resources and consumer companions that have come out recently with the ADHD guidelines. All right, so our key takeaways, I think I'm going over time. Sorry, Chris, is around the neurobiological reasons for ADHD, natural variations that exist. We know that ADHD is associated with a number of characteristics around that inattention and sort of hyperactivity, impulse control. We've talked about how that might present in different settings. Who can do assessments and diagnose, and the range, the benefits of the diagnosis and range of strategies and supports that are around. All righty, thank you so much.
Thank you so much, Daniel. You've covered a lot, and a lot of what you covered has helped answer some of the questions that have come through as well. So just a reminder, if you need to leave now, that's completely fine. Before you go, we'd really, really appreciate it if you could fill out the feedback form in the handout section. That'll help us make these webinars as helpful to you as possible. But let's jump into some questions. So we have a question from Sylvie here. It was in regards to that conversation about the parent voice and that teacher voice. So any ideas for what parents and teachers can say to a child or do instead of using that voice when that child's showing undesirable behaviors or not cooperating?
Yeah, this is really hard. I wish I'd just give you, I just got to do this and that. But it takes time for different children to work out what works for them. And it's a little bit embarrassing, but for my 8-year-old or my 9-year-old, it took me 8 years to work out what it was for him that allowed that connection, at that times, either when he's really upset or when things are sort of, and so just trying to understand and trial different things to suit the child. But it's not glamorous. There's a lot of, hey, Timmy, getting around in front, gentle touch, low tone. Naturally, it's Timmy. That's what I feel like my default parenting mode is, which is not good for a lot of sessions. But it's gentle, it's persistent, it's calm, and sort of you're grading up your level of sort of interference into their zone. Giving them that time, especially because a lot of the time they've got hyper focus and they have trouble, as we know, with ADHD and attention switching. And if it's around a screen, then the screens are all geared towards, mucking up our levels of, dopamine in the brain to keep us, engaged. So it's really against us for a lot of reasons. So gentle, graded, choose your moment. So I think I could talk a lot about this as well as the gaming aspect, but you got to pick your time as well. Because if you're trying to get someone and there's a minute left in Fortnite and they're one of 4 people who are left, anything you do in that minute is going to be, catastrophe. So you got to sort of recognize, we're in the lobby. Now's the time to, potentially intervene. So, that's just one example. It might be gentle touch, voice, repeated, getting in the zone of their sort of their focus, and choosing the right moment. Some potential examples, but yeah, different kids will have different things. Maybe cards will be a different way, or different objects to help provide that clue as well, that this is the time to bring your attention to me.
Amazing. A lot of helpful tips there, Daniel. We have a related question from Amira. So if parents find it hard to handle these types of situations, any general tips or places that parents can go for support?
Yeah, wonderful comments. And I think, parent finds it challenging and at different times. And we all have our own different levels of capacity, lived experience as a parent, our own strengths and weaknesses in our own emotional regulation. I don't know how many parents out there, their parents did an emotion coaching program. Probably not that many. We were told other things, when we were younger. So I think it's really important to recognize what we can do. And so the tuning into kids program is a way that helps that that recognition of what we're feeling. It's all part of that emotional regulation process. A wonderful skill to learn, often one that needs to be practiced and taught. So I think that's a really useful thing. And interestingly, another parent said to me something fascinating, which has really stuck with me for a long time. And it's like, it takes an emotionally regulated parent to regulate the emotions of their child. And only when they really, grasp that, then they were able to, make that shift. So whatever it is, because we all have our own stuff at different times, everyone does. And if there's something that's, potentially getting in the way of us being, delivering the type of intervention that we want to, I think it's a really good time to talk to someone or speak about it. Tuning into kids, or your GP or others around you who you can share that with. Having those conversations, I really, just like that sharing. I think that's a really important part, because I think so much as parents, we feel shame about, which is, it's the least helpful, I think, of all the different emotions.
Thanks for that, Daniel. So we have a two-parter from Narelle and Charmaine. They're just after any tips for how to start communicating to a child or a teenager that they may have ADHD, especially if they might be reluctant to get an assessment.
Yeah, wow, really good question. A couple of things, I think, is modeling our own experiences with our own stuff, and talked about how we've experienced stuff at different times, and maybe what we've done and what we felt, and maybe that reluctance, and then overcoming that and how we felt, and it helped us in different ways. So I think modeling at the dinner table, sharing those experiences, that vulnerability, I think, can be really helpful, and keeping it laid to the different kids at different stages. But I think modeling that and sharing those experiences, and as I said before, like, not that this is the goal of everyone, nor should it be, but the wealthiest people in the world, have a range of different, DSM diagnoses, and that's okay. So sharing those champions that are, or potential champions in our society, with their experiences. And there is one thing, and this is a bit embarrassing, because I'm going to show a book which was recommended by a family, and it's just over there, and I'm going to get the cover, so bear with me. This isn't in the resources section. I'm going off script a little bit, but hopefully you can see that, the brain forest. But that is something that a couple of families have recommended to me, talking about the different variations, those natural variations that exist. So I think, a combination of those things over time, building, and creating that space to listen and hear and help them be validated, in that experience. And that's okay. I tell a story about how I have to take medicine every day, and I don't like it. I actually hate it. I have to squirt it up my nose, and it's unpleasant, but I do it every day because it helps me feel better in the long run, especially on windy, pollen-filled days like we've had today.
Thank you. Some helpful tips there. We've got a question from a few people in regards to that parent voice. So some people are saying that does get cooperation from their kids, what are some considerations or positives or downsides to continue using that voice?
Yeah, it's a great thing, and I'm not drawing on a lot of evidence here, so I feel like reluctant going into a lot more detail about this. But yeah, this, like, I bring it out, it helps. But I think the concept is, if we keep on having to escalate over time, that's the danger. It may not happen for everyone, but if we do for kids and we're escalating in regards to common characteristics that they have, more often, sometimes that can accumulate over time and affect their sense of self and sense of worth. Not saying that's necessarily in your experience, but children with ADHD can experience a lot more sort of negative feedback, and as we sort of raise our voice, that's in that zone, potentially of giving them that negative feedback. So it's tricky balance, and but yeah, it really resonates and interesting that, like, the parenting voice, and ever since hearing that, I've been reflecting personally on my parenting, which I do a lot, maybe way too much, I don't know, but and I found that in my default mode, that's what I resort to, I worry sometimes about the impact it can have on the kids with those tendencies.
So much, Daniel. So we have two people who've asked a similar question. So we've got Trina, and also um, I've lost the name, but two people are asking that like if you could see signs at home of ADHD, but the teacher doesn't see the same signs. Could this be a sign of masking? Where can people get help if they're noticing that there's this discrepancy?
Yeah, excellent question. I'll just cover that in a moment, because there's one more thing I wanted to say for the previous question,
Sure.
and that is the most effective way to get repeated desirable behaviors is through praise and rewards in whatever form is meaningful and valued for that kid. And I talked about praise and that connection. Sometimes it takes time to work out exactly what it is for your child. That's my personal experience. To get that meaningful connection at that time, to provide that reinforcement, because it's much more than a sticker chart, isn't it? For that praise and reward and creating that positive reinforcement, rather than sort of the other side. Okay. Yeah, really tricky one when we see symptoms at home and don't see them at school. And there could be a couple of reasons for that. Sometimes it's because the symptoms are there at home, and then they're there at school, but they're not being recognized by others, or they're not there at school because some effort is going in order to modify the behavior to that particular social context or scenario. And that can be good or not so good, depending on what the impact is on their life, because we all modify our behavior at different times in different situations. I'm modifying my behavior right now as I give this talk, but if we're doing it every day at school, sometimes it can come with a cost, or in different situations. And that cost can be, it takes a lot of effort, it's exhausting, and it doesn't leave much capacity for fun, because they're just so drained and exhausted and sort of burnt out. It's spinning the wheels so much, so to speak, in other parts of the week. And it tends to build during the week at school, go away in the holidays, and school might be one situation, socially might be another. And so it really depends on what the impact is from changing or modifying that behavior to different sort of social contexts. Sometimes it can be from anxiety as well, because anxiety can compress or control what kids are experiencing or feeling. And unlike ADHD, we know anxiety has also been going up and up and up and up, and can mimic ADHD in other areas. And they get home and there's this big explosion of emotions, because they've been in a zone like a caged tiger, or not a caged tiger, but in the cage with the tiger, and trying to control. Their brain is telling their body that they're in danger, getting physical symptoms of anxiety sometimes, and then that can release at home. So it's a really tricky one and hard to unpack those differences between whether it's, they're there and they're just not recognized, but you can tell the symptoms at school, or there's no symptoms at school because they're, modifying, and whether or not that comes at a cost, or whether that's not coming at a cost and it allows them to function well in that, in that situation, or it's something else. Yeah, very, very good question. Very tricky to sort of to unpack. And yeah, good question. I don't know if I've given that the world's best answer though, because it's so hard.
No, that's great, Daniel. Thanks for the different perspectives on that. So we've got a question from Justin and Sylvie. So they've mentioned that their child is in primary school and a lot of things are done on tablets. They're concerned that their children in particular will kind of get stuck on the technology. Should there be much concern there? Is it worth doing anything about it?
Yeah, good question. I think different kids respond to technology in different ways. And there's a like wonderful talk I've listened to from the Game Aware group that talk a lot about this game addiction. And for, some kids, especially, it seems to be those with ADHD. There can be this dopamine surge with certain, games or devices, and then they get this dopamine burnout where you may have recognized it, been on screens, and then you're like, all right, screen time's off, we're putting that away, go and have some fun, it's a nice day, and then it's like, but there's nothing to do, because that surge of emotion, of feeling, and yeah, pleasure that they've gotten at that time of the device then means that there's a period of time where they've got to adjust to sort of regular everyday activities. And I think different kids experience this in different ways. Difficult in the school setting, and I'm not going to pretend like I'm an expert in terms of managing, that in the school, because I think that is really hard. But I think when you're setting up expectations or things, outside of school, being really cautious that some kids do have much more of a tendency for that, and helping them be aware of that, developing that understanding over time. All of this, takes time to sort of be aware of what our experiences are on the screen, for better or for worse. So very hard, I think, in the school setting. Some kids are very sensitive to it, and at home, we want to build up their awareness. And it's hard when you give them something to then go back on it is very tricky as well. So try not to give in too much, even if all the other parents are doing it, and all their kids that all the kids. Oh, my kid always is like, oh, this kid plays Fortnite. He's got Fortnite and he does it every night. And I'm like, we've spoken to their parents. It's just not true. They don't do that, even though that's what they say at school. Like, really? Yeah. So I think having those conversations as well.
Amazing. Thanks for that, Daniel. So we've got a question here about school again. If parents wanted to, pick a school where people like yourself might support the teachers with supporting kids with ADHD, like how could they go about doing that?
In terms of, I'm not sure if it's like around picking the school or around in getting help from other professionals to sort of advise the teachers. Do you know if it's which one it might be, Chris?
I'm not sure, but
Mm.
let's say both.
Yeah, I think picking the schools, no evidence to say one way is better or another. I'm going through this, for secondary school, for my kid trying to work out. And I think I put all this effort and time into the first, and the second will just go wherever's geographically convenient based on where the first is chosen. So picking schools, I think, is really difficult. But I do know that some schools place more expectation on the kids to do things individually. And I think that if you've got a kid who needs extra help in those areas around organisation, then those two things are not necessarily going to align, because we want to make use of their strengths. And if we're making them do more things that they find difficult, I think it is going to have a potentially more challenging experience. No evidence in that. That's just my feel on looking at others' experiences. The other part in terms of helping the school know what necessarily to do. The schools have access to wonderful resources about this. one of the things that I like to sort of reflect on is what helps at home, and then formalizing that, into a document of like this, when this happens, we do this, this helps. Because there's like a big long list of things we can do in ADHD, but we don't know which one's going to be the most useful. Going to get stuck. Just add another, 20 strategies. And I think that doesn't work. What I think works is there's going to be 20 strategies that could help. 10 of them are able to be implemented in the school setting. 5 of them actually maybe get implemented. And then of those 5, 3 might be helpful. Then it's really important, through the communication with the school, with the teachers, parents, the supports that are available within school, is we make sure that we reflect on what those 3 are, why they're helping, maybe add more in, and make sure those 3, strategies or more over time are passed on from year to year. And that communication, the schools are fantastic at this, is offering those times every sort of 3 to 6 months of that feedback and review session of, what it is that we're seeing, what we've tried, what's actually helped, what are we going to try and change over a little while. Just that, that accountability to a certain extent of, this is what we're trying, this is what's helped, this is what we're going to do going forward. So I think being very structured in that. I don't do a lot of that, actually, interestingly, but I direct the parents, through correspondence to have those conversations, because ultimately, the parents know their child best and what's helped and what hasn't. They've got a far more detailed experience and rich, knowledge base. It's just about building up that confidence to share it, with the school.
Amazing, great advice there. So that concludes our Q&A. Thank you everyone for putting in your questions. Just a reminder, if anything we've discussed concerns you, there are a couple of places that you can go for support. Also, a reminder that there's a free app called Raising Healthy Minds. It supports you with supporting the mental health of a 0 to 12-year-old child. Now, thank you everyone for your time tonight, especially to our speaker, Dr. Daniel Payton. Before you leave, please complete the survey in the handout section on the right. We hope you found this valuable. We covered a lot, so feel free to revisit this when the recording comes through, and also at the Raising Children Network. That's it from us. Have a great night, everyone.